I took out all the subcommittee references.
There it is.
There it is. Okay.
All right, good evening, everybody. This is our Friday evening public hearing. So I'm hoping that you're all ready and prepared for a robust Friday evening. We have 8 speakers signed up, and not all of them are here yet. So let's see. Representative France, do you have any comments?
Thank you, Madam Chair. I'm looking forward to a good discussion on the issues that they're concerned about. Thank you.
Very good. So I know that Jeremy Stein is on. Jeremy, you want to go first? You're first up, sir.
Sure, great. Thank you very much. Good to see everyone. I'm Jeremy Stein. I'm the Executive Director for Connecticut Against Gun Violence. I'm testifying in support of the budget increase to Project Longevity as included in the governor's proposed budget. This past year, gun homicides were the highest in 25 years with 118 homicides in Connecticut. The Hartford Courant declared that 2021 was the deadliest year in Hartford since 2003 with 35 homicides. In 2020, gun homicides increased 50% in Connecticut compared to 2019. We must invest more in reducing community gun violence using proven programs like Project Longevity. The Project Longevity model, which is a group violence intervention strategy, also referred to as focused deterrence or ceasefire, has been studied for years and has been proven effective through evidence derived by more than 60 peer-reviewed studies. When properly funded and staffed, we know Project Longevity works. In New Haven, it was associated with a reduction of nearly 5 group member involved shootings and homicides per month. Homicides in New Haven, Hartford, and Bridgeport dropped by about 75% in 2011. Actually dropped from 75, in 2011 to 31 in 2016, a reduction of more than 50% after Project Longevity began. The Givers Law Center estimates that the direct measurable cost of gun violence is more than $400 million annually in total, including the cost of pain and suffering. It's estimated that the annual cost of gun violence in Connecticut is a staggering $1.2 billion. Additionally, the Law Center grades all the states and the strength of its gun laws and suggests that Connecticut could strengthen its ability to reduce gun violence by continuing to strengthen investments in community violence intervention programs. While funding fully Project Longevity, it's very important. The state also needs to invest more in preventing community gun violence that disproportionately affects Black and Brown communities in Connecticut. Gun violence, group violence intervention strategies are most effective when they are working with community-based programs. That's why we are asking you to support a state-level Office of Community Gun Violence Prevention, a state-level grant-making authority tasked with funding and implementing evidence-based informed community-centric programs and strategies to reduce street-level gun violence. Dedicated staff, resources with multidisciplinary expertise and budget line funding. When we will be back on before this committee on the 24th to recommend an increased investment in our communities to reduce gun violence. This strategy to invest has been very successful and implemented in states like California, Maryland, New Jersey, Massachusetts, and Rhode Island. These states have been investing millions of dollars into preventing community violence. Unfortunately, Project Longevity is currently the only dedicated gun violence prevention strategy that is consistently funded by the state. More must be done, and Connecticut must once again lead on this issue by increasing its commitment to these communities and funding evidence-based solutions to reducing gun violence. If we invest more in the community and more in community-based violence programs, we would not only save lives and reduce the trauma inflicted on these communities, but it would also save money for taxpayers by reducing the staggering cost of gun violence. We support more funding for gun violence prevention programs and urge you to fully fund the Office of Policy and Management budget for Project Longevity. We thank you for your consideration. I'd be happy to answer any questions.
Thank you. Are there any comments or questions? Seeing none.
Can I just
Representative McCarty.
yeah, thank you, Senator Austin. To Jeremy, is there anywhere that the project is outlined and there's a description of the entire project and some of the recommendations. And did you submit testimony for this evening?
I did.
Okay, thank you.
And when you were talking about the project, you were talking about project longevity itself or the Office of Violence Prevention?
The project longevity itself.
Yeah, I think it's fully fleshed out. I'd be happy to get any information on project longevity. It's been in Connecticut for quite some time. I know they're trying to expand it into Waterbury as well. It's currently in Hartford.
It's in Waterbury too. We expanded it last year. Representative Baker.
Thank you, Madam Chair. This is more of a comment rather than a question. Jeremy, thank you for the work that you do. And, I've seen you on the ground. You've been in Bridgeport many times. I appreciate you. I think that, the amount of work that needs to be done on the ground out in the communities, I don't think that Project Longevity is funded enough. So, I'm definitely in favor of giving more, but I think there's so much more that we can do in terms of that. So I appreciate all you do and thank you for the work you do and continue to work with you.
Yeah, thank you, Representative Baker. And I appreciate all the work that you do and your presence in the community. And you're absolutely right. There are so many more programs that could be funded, so many more solutions. Project Longevity is just one part of all this, but we really need to invest more in the communities.
Thank you. Representative Nolan.
I just wanted to also agree with Representative Baker in regards to the need to invest more into violence protection, especially when it comes to gun violence, and to create a larger or a broader opportunity for other programs to be involved and get involved in and spread out throughout Connecticut to make sure that all communities are covered equally. So thank you for coming, and thank you for some discussion that we've had prior. You also have my support, and we're looking forward to trying to make things work.
Great, thank you very much, Representative Nolan.
Thank you, Madam Chair.
Thank you very much. Thank you, Jeremy. Have a nice
Thanks,
night.
Senator Austin. You too. Have a great weekend.
You too. Up next is Rob Chatham. Rob,
Yes, hi, how are you?
good, how are you?
Okay. I'd like to say good evening, Chairwoman Walker, Chairwoman Austin, and members of the Appropriations Committee. My name is Robert Cheatham, and I'm a member of ASME Council 4, Local 478, which represents employees at the Department of Motor Vehicles. The members of Local 478 have been doing critical work and providing services to the public through very difficult times. I want to take the opportunity tonight to speak about the proposed Department of Motor Vehicles budget. In recent years, we've seen increasing privatization of the Department of Motor Vehicles and a continued lack of staff at the remaining locations. It is not uncommon for me to hear coworkers talk about transferring to a different agency due to the stress of understaffing. The employees at the DMV deserve to have funding that fills vacancies and will allow us to provide quality service to the public that they deserve. Adequate funding for the department will help provide funding for more staff and keep offices staffed as we approach the coming retirement cliff. Refilling vacancies and hiring staff for retiring employees will help avoid further privatization of DMV services. The increased privatization has been troubling for many of us that work in the agency and add to an already stressed workforce. We often hear legislators say that AAA is an answer, but AAA operates under the old computer system that the DMV used to use instead of the privatized 3M disaster that the state employees are using currently. If they had kept this work in-house and not privatized the computer system, it could have avoided problems and maintained a system that worked. Privatization allows for the public sensitive information to be handled by employees that aren't accountable to the people of the state. Additionally, the DMV is a significant revenue stream to the state and improving staff and officers will continue improving our public relations rather than furthering privatization that could put this revenue at risk. I want to urge the committee to provide adequate funding for staffing at our offices so that we can fill vacancies and prepare for upcoming retirements. Thank you.
Thank you very much, Rob. Appreciate it. Does anybody have any questions or comments? Seeing none. Thank you so very much, Rob. Appreciate you coming.
Okay, have a good night. Thank you.
You
for having-
too. Have a nice Friday. Up
Same to you.
next is Kate Diaz. Kate, you've been on every meeting I've been to at night. And don't you have enough of us at night?
I was just thinking, I'm feeling like a regular, like I have, like we should all go out for drinks after or something. But I really do. My treat, maybe. I don't know. Probably I can't do that, but that's
You can't do that.
that's okay. If the thought's nice.
Oh, we could.
All right, well, we'll talk later. Well, I genuinely do appreciate your time this evening. As noted, I am Kate Diaz, president of the Connecticut Education Association, and third-time testifier for the Appropriations Committee. And I'm really grateful to be here tonight. And I'm really, really excited because I'm expanding who I'm here for. Normally, I come sharing with you all of the good news from the educators across the state that I represent. But we also tonight come with a coalition of parents and labor unions, bringing together trade workers, educators, public employees, and healthcare workers. And we really do stand together tonight in support of the additional $90 million to focus on indoor air quality in public schools. You know, when the coronavirus hit us in March of 2020, we became overwhelmed with the clarity that our failure to invest in maintaining and improving those ventilation systems was going to have a dramatic consequence. It shut down our schools, our inability to really rely on quality air. So when we come back to you, we're looking at this really with the desire to have safe schools that can remain open and really don't compromise our ability to guarantee the necessary air filtration. When we have problems in schools, you know, it's a challenge. We know that there's a lot of cost, but these are spaces that really we do need to preserve and protect. And it's incredibly important that we look at it not just at schools, but often other public buildings as well suffer. Hospitals, post office, even your offices in the Capitol and the Legislative Office Building. So we know that decades of not maintaining and improving those systems has an overwhelming impact on the health of our communities. So we are really grateful to see the $90 million. Little underestimation there. But what we really are also looking for is increased regulation that ensures that this investment we're making today continues and is maintained moving forward. We want to make sure that the work being done is done by licensed contractors that really ensure that we maintain these systems and we have the acceptable indoor air quality. We know that this is a big task. We know that this is really the result of years and years and years and years of putting this on the back burner. But if COVID has taught us nothing, it's taught us that this is incredibly important, and continuing to neglect this issue is just not an option. So again, with this big coalition, we hope that you'll consider what are the standards we can implement. Let's get ourselves at least on par with pet stores. Let's get our kids in pet stores at least in alignment with expectations. And let's make sure that those systems are not only developed today, but maintained in the future going forward. So we look forward to working with you further on this. And we do really encourage you to think about a further investment, including looking at bonding structures to see if there's a place for bonding to fit. We think roofs are essential. We also think HVAC is essential. So hopefully there's room and space for this issue, and we can really make some big changes that is a huge investment in our communities. And I view this as something that doesn't just impact schools, it impacts our whole economic basis for how we sell our state as a real thriving and exciting and wonderful place to be. So I thank you. I am grateful for yet another opportunity to join you, and I look forward to seeing you in person at some point in the near future. Thank you.
Thank you very much, Kate. Representative Walensky.
Thank you, Madam Chair. Kate, thank you so much for bringing up a subject that is pretty important to me. And you're not going to hear me say this very often, but I think the $90 million for indoor air quality in our schools is not enough. When I do the math compared to what we're in the process of investing in one school building here in Newtown, that 90 million looks to me to be, maybe 15 schools statewide, which is a drop in the bucket considering that we have, like you said, kick this can down the road, literally for decades. It's a matter of teacher safety. It's a matter of student safety. It's a matter of really public health that we assure that our indoor air quality in these school buildings is kept to standard. And I agree with you that regulation needs to be promulgated so that we keep up with it and don't let it get to the way it is right now. So thank you. Sorry for the opine, Madam Chair, but this is pretty darn important. Thank you.
Thank you.
Thank you, Representative Valinsky. Representative Brandt.
Thank you, Madam Chair. I appreciate the bringing this to light and looking at the modeling of the program. And I think you mentioned your testimony is modeled similar to the roofing program for schools. And I guess just from a point of perspective, that the program includes a town match for the funding. I guess the CEA have a position on that, supporting the town match component for this, so that there's a sharing of the cost between the town and the state in this program.
So similar to the other bonding initiatives, we would be looking for just an expansion of the bonding program to be inclusive of the HVAC programs. Obviously, the initial investment we know has to be a little bit more substantial, but we have access to some of the federal funds. That what we've learned over the last 2 years is that if there's not a regulatory requirement, that the districts won't necessarily move towards meeting that need. So that's kind of why we're marrying the asks, recognizing that without some sort of statutory statement or some sort of regulatory statement, that there's not really going to be the shift quite as significantly as we would like. So the 90 million might get us off the ground, but we are really going to need to look at investing into that, as you indicated, along the traditional bonding structure. Their districts will need to look at, where the matching component can come in, how that can be structured in a way that, again, provides the access, which I think is what we're really trying to get to. Is right now that's a closed door for us. And so we end up back in school buildings with 95-degree temperatures, mold issues. So I think the opening the door is what we're really looking for. We would be in favor of that.
Thank you. Thank you, Madam Chair.
Representative McCarty.
Yes, just very quickly, I just wanted to welcome Kate and say you could be an ex officio member of Appropriations at this point. But thank you for being here and for your perseverance and advocacy on this issue. And I know Senator Austin also really continued to press this issue. So I think it is a very bipartisan matter. It was on the Education Committee agenda today, and there will be a public hearing. I think you've captured the attention of everyone, and we are looking forward to long-term solutions as well. So I just wanted to put that out there, and thank you again.
Much appreciation to all of you.
Thank you very much. Up next is Travis Woodward, also someone we've seen a lot of. Go ahead, Travis, you're up.
Thank you, Senator. So Senator Austin, Representative Walker, Senator Minor, Representative France, and members of the Appropriations Committee. My name is Travis Woodward. I'm a resident of Hamden and an engineer at the Connecticut Department of Transportation. I'm also president of CSEA SEIU Local 2001, a labor union representing over 23,000 state, municipal, Board of Ed, active and retired public and private sector workers. I submitted written testimony and I encourage you to review it, but I'd also like to touch on a few matters that are not in my written testimony. I'm testifying today to raise your awareness of the amount of money that the state of Connecticut spends every year on outside consultants for work that can be done for far less by in-house state employees. By reviewing DOT's own cost evaluations, Connecticut wastes over $100 million annually on outsourcing engineering and construction inspection services alone. A properly staffed DOT will put an end to this waste. Cost is not the only factor when considering outsourcing. Over the years, Connecticut, like the rest of our country, has added to our DOT horror stories when it comes to constructing and maintaining our highways and bridges. In 2008, we had our own version of the Big Dig. We had the Little Dig moment in Waterbury, where consultant inspection staff failed to notice that drainage runs under I-84 were incomplete. A DOT engineer from our own union, CSEA, discovered this $24 million error that would have eventually led to the highway washing out, causing catastrophic damage and possibly the loss of life. In 2016, a consultant bridge inspector out of New York was arrested for falsifying bridge inspection reports. He sat on his couch at home and copied previous year's reports. Well, why is that a big deal for us? Well, that same inspector worked on 35 bridge inspections in Connecticut, all of which needed to be re-inspected at Connecticut taxpayers' expense. It was estimated to cost $500,000, but what would it have cost if just one of those bridges failed or fell? In 2018, FIG Engineers was cited by OSHA for their involvement with the Florida International University pedestrian bridge collapse, resulting in 6 deaths, 10 injuries, and 8 vehicles being crushed underneath. Why is that a big deal for us in Connecticut? In 2019, Connecticut DOT chose FIG consultants to oversee and inspect reconstruction of our own Aragoni Bridge in Middletown. With the passage of the federal infrastructure package, Connecticut stands to receive billions of dollars to upgrade our aging highways and bridges, a once-in-a-generation opportunity. We have the opportunity here to do the wise thing and invest in our own engineers and inspectors, or continue wasting hundreds of millions of dollars annually. State employees do it better, faster, and for far less. Thank you for hearing my testimony.
Thank you very much, Travis. Any comments or questions? Thank you so much. We appreciate you coming. Have a nice night. Have a nice Friday. Sherry Dayton.
Hello, good evening, Senator Austin, Representative Walker, and members of the Appropriation Committee. My name is Sherry Dayton, and I'm a Divisional Vice President of AFT Connecticut for Healthcare, the President of Backus Federation of Nurses, and a full-time emergency department nurse. AFT Connecticut fully supports providing 4 new positions in the Office of Health Strategy to manage and respond to increasing numbers of certificate of need applications, healthcare policy implementations, and evaluation activities. This increase must happen due to the alarming numbers of healthcare organizations shutting down services. These cuts tend to occur in low social economic communities and cause health disparities to worsen in our state. We could talk about several different organizations that have shut down. The closest one to my heart is the Wyndham Hospital, owned by Hartford Healthcare, that just shut down their labor and delivery department without even filling a certificate of need out. Despite being found in the wrong, they so far have only been issued a small fine in comparison to their multi-million-dollar worth. Now, family giving birth in Wyndham, Willimantic area must travel 30 to 45 minutes. This is dangerous and can cause poor patient outcomes. It's a drain on resources when an ambulance is needed for transport, and it's a massive loss to this community. Please stop this from happening here and in other cities in Connecticut. Another issue I would like to talk about, and I'm very grateful that you guys have formed a task force, but I think that we need to consider doing more with the health department. The Department of Public Health needs resources to be able to hold executives running healthcare chains accountable for their quality of care. Families deserve to know if their loved one can count on safe patient limits during their hospital stay. Mandations have been occurring more frequently due to the pandemic, and it's causing nurses to be tired. A 16-hour shift at a grueling, stressful job dealing with 6 people is very difficult. I've done it myself. And it's not safe. So I'd like you to consider that. Another topic of concern for me is the lack of essential workers pay for private sectors. We appreciate that money was allotted to the state employees, but healthcare workers and essential workers across the board deserve compensation for their sacrifices during the COVID pandemic. With over 10,000 Connecticut residents dead from COVID-19, I don't think we can argue whether or not that working in this pandemic has been hazardous. It is. Thousands of essential workers have died of COVID. We don't even have accurate numbers on this because no one's really monitoring this closely. So please consider honoring the people who could not stay safe in their homes, but left to care for COVID patients, to feed us, to keep this world functioning when it was under stress. Thank you for the opportunity to discuss these critical issues.
Thank you very much, Sherry. Does anybody have any questions or comments? Senator Lesser?
Yes, thank you, Madam Chair, and thank you, Sherry. Just with regard to your first point, very concerned about hospital consolidations and some of the closures we've been getting. I don't know if you saw in the governor's budget, he proposed adding additional funds to the Office of Healthcare Strategy to try to create some more, a bigger ability to review CON proposals and hopefully head off issues like that. Is that enough? Is that something that you think would be helpful?
We're very appreciative of that. And yes, it would definitely going to be helpful. I think if you look at the mounting severity of this issue, though, I'm hoping it's going to be enough. It's certainly moving in the right direction, but I think you guys need to keep a real sharp eye on it because, it's not typically a good thing for patients when the big fish swallows the small fish. We're seeing that more and more. And then we're also seeing that these profits are before patients, we're not making enough money to keep labor and delivery open at Wyndham Hospital. But I mean, there's a lot of sleight of hand going on there. The reason that the births declined at Wyndham Hospital is because they didn't necessarily negotiate a fair wage with Manchester OBGYN, who then took their patients with them to Manchester Hospital, and then Norwich OBGYN was then covering both Bacchus and Norwich and Wyndham, and that caused births to decline because Manchester took their patients. But did births decline actually in the Wyndham Willimantic area? No, they just now are traveling 30 to 45 minutes to get to be with their doctor, So, I mean, there's a lot of sleight of hand going on. And I think we just need to pay attention that these organizations' agendas have nothing to do with patient outcomes per se, and more about profit and where they can make their money. And they have plenty of money. Let's just say that they weren't making a ton of money at Wyndham. They have enough money. I mean, they just purchased like a $7 million commercial on the Super Bowl. Harvard Healthcare's cardiology group did. So, I mean, there's plenty of money if they're not making hand over fist on L&D. But that community, which is mostly Black and brown and low socially economic, need L&D. They have a hospital right there that has had, when I was walking around Willimantic having people sign the petition, women kept saying to me, I had my babies there. Grandmothers would be like, oh, I had all my kids there. I want my grandchildren to be born there. But now they can't be. They have to travel 30, 45 minutes when there's a hospital right there. And the same things happen in Sharon, Johnson.
Thank you, Sherry.
Thank
Are
you.
you well, Senator Lesser?
Yes, I am, Madam Chair. Thank you so much, Chair.
Thank you very much. Have a nice Friday, Sherry. Thank you for stopping and talking. I felt I was talking all day out of my car, so I'm hoping you're not doing it for the same reason I was, because I had no power. But have a nice Friday.
Thank you. You too.
Madam Administrator. Do we have anybody else? I think we've talked to everybody that's here.
Yeah, there's no one else in the waiting room to promote, so.
All right, can you, we have, I guess, Senator Minor? Do you want to testify, sir?
Can we just talk amongst ourselves for the next 6 hours?
No, we cannot.
I'm sure Senator Lesser would like to go for a half an hour, and then I could go for a half an hour.
You all can, but I'm shutting the Zoom down, and so is Sue.
You can filibuster.
Before we do that, I just want to find out, Sue, what do we have going on now that we've made it through Hell Week? Do we have what's next week look like?
Oh, we finished with a flourish, Madam Chair.
I know.
With a flourish. So on the 22nd, we have at 1 o'clock, we have the Higher Education State Agency presentations. We also, and that runs from 1 to 3. At the same time, we also have the Human Services Subcommittee OFA briefing. And then in the evening, starting at 5 o'clock, and if I am allowed just a little point of personal privilege myself, one of my absolute favorite hearings, which is the public hearing on higher education agencies. We will start at 5 o'clock and we will have our student panels, which will run from 5 to 7:30, and then any members of the public who are interested in testifying that testimony will start at 7:30.
Thank you for that. So we have another busy week ahead of us, and we do have a number of contracts coming up too.
We do on Friday, we're going to hear of arbitration award and vote on the arbitration award. That's also our committee and raise bill deadline, and we will be reserving some bills for subject matter public hearing, as well as raising some concepts.
And I think the chef contract is coming here also.
The chef agreement will be coming our way at some point. Yes, Madam Chair.
Yep. Anybody, Representative Nolan? Did you just ask me something? No?
No,
All
I'm
right.
sorry.
Okay. Anybody else have any questions? That'll give you a little flavor of what's going next week.
Nope,
I hope you all-
thank you.
I hope you all have a nice day. Martin, do you want to say anything to the group?
Well, thank you, Madam Chair. It was nice spending last evening with you for as long as I did.
Representative France.
Everybody enjoys their weekend.
All righty. I'll see you all soon.
Good job.
Thank you,
last
Madam
night,
Chair.
Everybody.
Bye,
Good night.
guys.
Have a good weekend.
Thank you, Stu, Taylor.
Bye.
Thank you, Sue.
Have a good weekend, everybody.